Hello friends. Today I am going to talk about hypertension. Now I classify hypertension as physiological and pathological, and books classify them as primary and secondary. Why I call them as physiological hypertension, some of the hypertensions as physiological, because they are because of some alteration in our physiology, because of our sedentary lifestyle, because of our erratic food habit, stress, high salt, smoking, alcohol. So all these they lead to hypertension. Then because of age, obesity, then hypertension running in family. These all are books. They classify them as primary. I call them as physiological because they when we go out to find out the causes among such people, what is the root cause behind the hypertension, increased pressure in this person, we won't be able to find any. So we correlate to many things, like if the person is obese, we'll tell him, okay, you have to reduce your weight. If his lifestyle is sedentary, we ask them to go for exercise. If his food habits are very erratic, we ask them to correct it. If his life is work and life is very stressful, we ask them to decrease the stress. If his age is like he is in his 40s 50s, then we tell ki it is because of the age related. So we attribute it to so many things without actually relating it to that same cause that we are asking him to correct. So this is primary or physiological. Now secondary hypertension, we find a particular cause, and secondary hypertension are more dangerous, and they can occur at any age, and they are even in early ages. So first and very relatable cause in secondary hypertension, a very significant, is a CKD, chronic kidney disease. Then it can be endocrinal, like adrenal dysfunctions, thyroid issues, Cushing syndrome. Then it can be your related to sleep apnea disorder, obstructive sleep apnea disorder. So these are the causes which are pathological. Here we know that this is the cause. If we treat the cause, we control the high blood pressure. Now, why blood pressure is dangerous? Blood pressure, most of us, they take it, okay, this is normal, but blood pressure is dangerous. Once the pressure increases, you may experience mild headache. That mild headache is persistent, and that disturbs your work. If we don't take control of our hypertension, that may lead to severe. That may cause paralysis to you. Then it increases the atherosclerotic process, makes our end arteries, the small arterial walls, very stiff, and that causes your coronary artery disease. Then there is a rupture of small arterioles because their wall is very thin. During sudden spike in blood pressure, that may lead to bleeding, and again it may produce symptoms of ischemia. So all these things may increases the morbidity and mortality associated with hypertension. Now, how to control hypertension? One which is primary or physiological, that can be initially controlled by your lifestyle modification. Correct your lifestyle, start exercise, leave your sedentary lifestyle, decrease salt in your food, try to ward off the stress at home, at work, take a regular break from your stressful works, try to keep yourself cheerful. And then another thing that is very important is, beside medications, that one thing that you can do is go for yoga sessions where your mind is calmed down and stress is ward off. If your blood pressure is not controlled by doing all these things, then we prescribe medications. But in secondary, you have to go for medication, because all these changes, your lifestyle modification, salt intake, all these is not going to ultimately control you. So along with this, you have to start the medication. There are few medicines which increases blood pressure, like hormonal birth control pills, NSAIDs, some steroids that you are taking. So you have to avoid that, and you have to start by avoiding those medications. The blood pressure can be controlled. So be cheerful, have a good lifestyle, leave the chair, start moving around, low salt diet, and happy man. That way you can control your blood pressure. Thank you.